Welcome to Hormones, Gut, and Skin Connection. I am Dr. Ruby Rose, a double board certified physician in integrative and functional medicine.
And I am Marisol Norwood. I am a licensed esthetician here at Snyder Plastic Surgery and Wellness.
On episode 1, we are going to talk about skin as an organ. And what is skin actually trying to tell you? Most people think that skin is just how you look, a cosmetic thing, right? We put creams on it, we do facials, we do all kinds of procedures. But medically speaking, do you realize that skin is actually our biggest organ? So just like your heart and your liver, your skin reflects what's actually going on inside your body. So things like hormones, gut health, inflammation, stress, nutrient levels, all of these things can actually affect your skin.
We have patients coming in every day wanting to address one area of concern with a topical cream. However, nobody's skin is the same, so one product might not work for you. So with a lot of the areas of concerns that people are coming in for, it's kind of telling us that there's something deeper going on internally.
Yes, absolutely. So let's talk about skin. So, what is skin made out of, right? What is it made of? Mm-hmm. So there are basically 3 layers to your skin. There is the epidermal layer, and that layer contains keratinocytes, which basically form that physical barrier. And they also produce lipids, and that kind of helps us with the waterproofing of the skin. And then it also contains melanocytes, which basically protect us from UV light. It has Langerhans cells, which are immune cells. These are sort of the sentinel cells. And then it has Merkel cells, which are sort of these mechanoreceptors that help us with sort of fine touch. And then the second layer is the dermal layer. This is sort of where the connective tissue and the collagen and elastin lives, and that sort of helps us it gives us the sort of tensile strength and the elasticity of our skin. And then the third layer is the subcutaneous layer, and that is the hypodermis, and it contains the fat, larger vessels, it has connective tissue, and it basically anchors our skin to the underlying tissue that is the fascia and the muscle. So all of this basically provides insulation, it provides mechanical cushioning, energy storage, and basically is the metabolic and endocrine fat depot. So skin is not just the protective covering, it involves all of these sort of dynamic, it's like this dynamic biological organ, which is so cool. And it really does function in a physical, chemical, immune, and metabolic way between your internal environment and your external environment. So when our internal environment is not right, it absolutely affects how we look on the outside.
This is why, again, everyone's skin is not the same. So if you are doing everything that you need to do externally with the products, having your great cleanser, your moisturizer, your SPF, all the things, and something is still an area of concern, or you just feel like you could get a little bit more of a push, this is your body again telling you something is going on internally that we are trying to figure out with you.
Right, yeah, because if they're not getting, like, things that you're doing to them is not helping, they must start thinking, or at least we're trying to tell you that, start thinking that there's something internally going on, right? Okay, so let's talk about skin and the immune system, because this is really important. This is kind of where we start really seeing a lot of the skin changes. So skin really actually is your largest immune organ in the body, believe it or not. It contains these immune cells that basically constantly monitor the outside environment for like bacteria, viruses, and even environmental stress, which is cool. So the immune cells basically help trigger this inflammatory response, and that the skin then detects this, that there's something actually going on, that there's something wrong. So that's why you start seeing skin conditions like acne, eczema, or atopic dermatitis. You see rosacea, psoriasis, things like that. So inflammation in the body definitely becomes visible in the skin, right?
This is something that we see every day in the treatment room. It's very common, unfortunately. For example, people with rosacea, if you're eating all the hot stuff, hot Cheetos, hot sauce, all the things,
Processed food.
It's triggering your body. It's triggering the appearance of the redness. It's triggering the
Inflammatory.
yes
Yeah.
of the redness of all things. So I actually had a patient the other day saying, I feel like my nose is getting fatter, and
gosh.
she says that she was doing all the things that she needed to do, but it all resorted back to the hot foods that she's eating and the hot showers.
Interesting.
Mhm.
Yeah. Gosh, there's so many things that we do to ourselves that we don't realize are actually harming us, right?
How bad it takes a toll on your body.
Diet is so important. It's so important. So yeah, let's talk about the gut actually, because the gut-skin axis is a fascinating bidirectional axis. It's super important. It's a great connection. I work with a lot of my patients about with their gut, and we start really seeing some improvements in their skin. So the gut microbiome actually plays such a huge role in regulating inflammation, the immune system, and nutrient absorption. So the biggest takeaway we want you to take from all of this is the fact that skin isn't separate from the rest of your body, that what you put in your body actually does really show up on your skin, and that the skin is connected to your immune system, it's connected to your gut, your hormones are involved in your skin. It reflects your nutrient status. I mean, your skin really does tell us what is going on internally, which is so cool, but it should also tell you that, there's something going on. Let me get that checked, right?
This is why it's important when we combine medical insight and skincare products or treatments. When you're tackling both of them, you're getting the best of both worlds. So you're going to feel better on the inside, and you're going to look exactly how you feel on the outside.
Yes, I love that. Well, hopefully we'll see you on the next episode where we're going to talk about vitamin D. We're going to do a deep dive on vitamin D, what it is, why you need it, what happens when you don't have enough of it, and how to increase it. So we'll see you next time.
Bye.
Bye.